Dr. Abiodun Paul is a public health physician and a medical laboratory scientist. He joins us right now from our Abuja studios. We'd like to thank you for joining us on the program. I'd like to begin. We heard the Minister of Health today saying that it's not enough to ask what the government is doing, but to ask what we ourselves are doing. So let me begin by asking, are you taking responsibility?
Yeah, taking responsibility is a word that should be asked everyone. Everybody should ask, that question should be posed to everybody in the country in terms of how are we taking responsibility. Number one, at the federal level, are we taking responsibility? At the state level, are we taking responsibility? At the local government level, at the community level, are we taking responsibility? Even as family, how responsible are we? It's a very strong question. And I had Dr. Chikwe, kudos to the Presidential Task Force and the NCDC. I heard what Dr. Chikwe was actually talking about, taking responsibility, asking the politician. Actually, this is not actually limited to only the politician. Everyone have to take responsibility. This is a call to everyone all over the country that it is a time for us to take responsibility. And how can we take that responsibility? By ensuring all the safety guidelines I strongly abide with. Right from the religious leader, right to the to political leader, to community leader, to individual. We need to ensure that all these safety measures that have been recommended by the NCDC, in terms of ensure that you wash your hands at least for 20 to 40 seconds, to ensure that you use face mask, to ensure that you keep social distancing, and many more. Waving, avoid any form of things that can, actually affect you. I think it's a call for all of us to know that COVID-19 is real, and this is a time for us to all. This is a question for every one of us to take a serious responsibility. I think this is where I would like to stop. Thank you.
Are you happy with the announcement on the new protocols for aviation resumption? And of course, there is election as well. I mean, are we really ready? When you look at the progression of the virus, seeing as, we haven't reached our peak yet, do you think that this is the right time?
Yeah, it's a good news because we cannot keep locking the country for forever. We have to take it one step after the other. But a point is very clear. With all the protocol, with all the guidelines for aviations, and the likes, we need to, to be sure that all these protocols, how are the people going to be comply with this? I heard what Dr. Sani Ali was talking about, that people have to be screened, people have to go from one place, one facet of the other at the airport. But they need to also understand that how feasible is going to be in a real implementation, in the real physical. You can have a very good guideline, you can have a very good protocol, but how well will people do with the compliance with these set down protocols? I have gone around, I have been to marketplaces, I've been to, to supermarkets, I've been to various places. I have not, the level of compliance is very poor. So we can have a lot of protocol, we can, like Shike was talking about the infection prevention and control guideline, all those things are good. But how are we going to assess the level of compliance? Are people going to be compliant? This is a big issue for the country. Compliance, because we need to change, work on our social and behavioral change communication. It's a lot of things that's really missing in terms of communication gap. So we really need to come together to see that we all take responsibility, just like the first question that you asked. Thank you.
Capacities for testing is increasing. We have about 40 molecular laboratories right now. There seems to be a lot of optimism with regards to how we handled Ebola, Lassa fever, even polio. But are you confident that with the way we're going, we will see an end to the virus progression in Nigeria? Or is it just, are we just hoping?
Yeah, Millicent, I need to, want you to understand something. when you look at the population of over 200 million people, and we've not tested 10% of this population, this is a lot of big issues for us. What do I mean? We've tested less than 200,000 people across Nigeria, and by my analysis, just like last week to this week, or let me say 2 weeks to this time, we've just tested like 20,000 people. By just simple mathematics, how long will it take to test the whole population of people that are interested, that is not based on case definitions, people that are living in fear, and when you look at the laboratory in a country, the way it's been networking, we still need a lot of testing sites in the country. We need to have more testing sites across all the 36 plus one, states in the country. The total number of testing sites we have in the country is not enough. With the number of the, NCDC have done well to move from 5 to 50, but that is not still enough. We need to look at it from an aspect of increasing the number of testing, just like India. India came third, in terms of testing across the world. What was the magic? As a point, Nigeria and India's case was just similar. But there were a lot of things, India put in place, and now we can see the magic happening. Though they may not yet there. So we still need a lot of testing laboratory across the country. We need to ensure that all the, local government take ownership, the community take the ownership, the federal government take the ownership, the state government take the ownership. Every facet, all the tiers, including the religious leader, need to come together, including the private. We can also leave out the private. There's a need to have a private-public partnership to increase our testing. The implementer partners, the NGOs need to come together. All the key stakeholders in the country need to really come together to
appreciate your
achieve
time.
Our testing target. We are still very far from our testing target. Thank you.
We'd like to thank you, Dr. Abiodun Paul, Public Health Physician, Medical Laboratory. Thank you for joining us on the program.
Thank you, Melissa, for your time. Thank you.
We have more on the COVID-19 updates when we return. Please stay with us.